Hello, today we'll be going over 2 pediatric NCLEX questions. Let's get started. An 11-year-old is admitted for treatment of an asthma attack. Which of the following indicates immediate intervention is needed? Once again, what are our keywords? And the keyword in this question is immediate intervention. They give us 4 options and it is not a select all that apply. So we see thin copious mucus secretions, productive cough, intercostal retractions, respiratory rate of 20 breaths per minute. Which one of these seems like it is the most immediate or the most urgent? If you said it was intercostal retractions, then you are correct. Just a hint, whenever you're taking tests, if you see intercostal retractions, that's usually going to be the right answer in regards to if a pediatric client is in any type of respiratory distress, that's what intercostal retractions indicate. So intercostal retractions, they indicate an increase in respiratory effort, and it's a sign of respiratory distress. During an asthma attack, secretions are thick, the cough is tight, and respiration is difficult. And that's why shortness of breath may occur. If mucus secretions are copious but thin, then the client can expectorate them. So then this does not require immediate intervention. If the cough is productive, it means that the bronchospasms and the inflammation have been resolved to the extent that the mucus can be expectorated. And a respiratory rate of 20 breaths per minute is within normal limits, so there's no intervention that is needed. So again, the best choice here would have been the intercostal retractions. Next question. The nurse observes an 18-month-old who has been admitted with a respiratory tract infection. See figure. And we see the child like this. The nurse should first, keyword here is first, always in your brain highlight keywords. Should the nurse position the child supine, which is basically face up, call the rapid response team, offer the child a carbonated drink, place the child in a croup tent. So you need to be able to identify in this question. Remember that NCLEX does not ask knowledge-based questions. You need to be able to recognize what is going on. The child has a respiratory tract infection and is sitting in this position. Why? Because a side effect of what's going on can be epiglottitis. And epiglottitis is when the epiglottis becomes inflamed and the child cannot breathe well. So they have to sit forward with their chin jutted forward in a tripod position. That's what we call this here, in a tripod position, in order for the child to be able to breathe. So if someone has epiglottitis or you suspect epiglottitis, you would never put anything in their mouth. Right now, it doesn't say that this infant isn't breathing. So out of all of these, which one do you think would be appropriate? So the right answer was place the child in a croup tent. The reason for this is because the child is in respiratory distress and is sitting in a position to relieve the airway obstruction. So the nurse should provide a humidified environment with a croup tent with cool mist to facilitate breathing and liquefy secretions. The child should remain sitting to facilitate breathing. If you put them face up or supine, you're going to interfere with their breathing, so you should not do that. The nurse should allow the child to determine the most comfortable position. After the child is breathing normally, the nurse can offer fluids. But right now, that's not the most pertinent intervention or the most appropriate one. The nurse can call the rapid response team if the respiratory distress is not relieved by using a croup tent or other vital sign changes indicate further distress. Remember, you call rapid response if you feel like the patient is declining. And right now, this question does not indicate that. So first we would try the least invasive, which is the croup tent, and then we could move on to see if the child is still not breathing with the croup tent. Then we need more aggressive interventions, such as calling the rapid response team. So hope this helps in regards to NCLEX questions. Thank you so much for watching and see you next week.